السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات Prometric Review of Prometric Test Questions. This is lecture number 6 in pediatric nursing. Today we are going to discuss 5 questions from question number 179 up to question number 183. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 179. A mother brings her 3-week-old infant to a clinic for phenylketonuria re-screening blood test. The test indicates a serum phenylalanine level of 1 mg per deciliter. The nurse reviews this result and makes which interpretation? The options are: number A, it is positive. Number B, it is negative. Number C, it is inconclusive. Number D, it requires re-screening at age 6 weeks. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number B. It is negative. ليه اخترنا الخيار رقم B؟ نشوف rational. Phenylketonuria is a genetic disorder that results in central nervous system damage from toxic level of phenylalanine in the blood. It is characterized by blood phenylalanine level greater than 20 mg per deciliter. The normal level is 0 to 2 mg per deciliter. A result of 1 mg per deciliter is a negative test result. So the correct option is option number B. Question number 180. A child with type 1 diabetes mellitus is brought to the emergency department by the mother, who stated that the child has been complaining of abdominal pain and has been lethargic. Diabetic ketoacidosis is diagnosed. Anticipating the plan of care, the nurse prepares to administer which type of intravenous infusion? The options are: number A, potassium infusion. Number B, MPH insulin infusion. Number C, 5% dextrose infusion. Number D, normal saline infusion. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number D, normal saline infusion. اللي اخترنا الخيار رقم D نشوف rational. Diabetic ketoacidosis is a complication of diabetes mellitus that develops when a severe insulin deficiency occurs. Rehydration is the initial step in resolving diabetic ketoacidosis, and normal saline is the initial IV rehydration fluid. So the correct option is option number D, normal saline infusion. MPH insulin is never administered by the IV route, and dextrose solution are added to the treatment when the blood glucose level decreases to an unacceptable level. And intravenously administered potassium may be required depending on the potassium level, but will not be part of the initial treatment. So the correct option is option number D, normal saline infusion. Question number 181. The nurse has just administered ibuprofen to a child with a temperature of 102 Fahrenheit or 38.8 centigrade. The nurse should also take which action? The options are: number A, withhold oral fluids for 8 hours. Number B, sponge the child with cold water. Number C, Plan to administer salicylate in 4 hours. Number D. Remove excess clothing and blanket from the child. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number D. Remove excess clothing and blankets from the child. اللي اخترنا الخيار رقم D نشوف rational. Cooling measures such as removing excess clothing and blankets should be done when a child has a fever. So the correct option is option number D. Remove excess clothing and blankets from the child. The child can be sponged with tap water but not cold water, because the cold water can cause shivering, which increase metabolic requirements above these already caused by the fever. Aspirin is not administered to a child with fever because of the risk of Reye's syndrome, and oral fluid should not be withheld to prevent dehydration. Question number 182. A child has fluid volume deficit. The nurse performs an assessment and determines that the child is improving and the deficit is resolving. If which finding is noted? The options are number A. The child has no tear. Number B. Urine specific gravity is 1.035. Number C. Capillary refill is less than 2 seconds. Number D. Urine output is less than 1 milli per kg per hours. وقف الفيديو هنا واختار الخيار بتشوفه صحيح. The correct option is option number C. Capillary refill is less than 2 seconds. اللي اخترنا الخيار رقم C نشوف rational. Indicators that fluid volume deficit is resolving will be number 1. Capillary refill less than 2 seconds, specific gravity of 1.003 to 1.030, urine output of at least 1 ml per kg per hours, and adequate tear production. So the correct option is option number C. Capillary refill is less than 2 seconds. Urine output of less than 1 ml per kg per hour and specific gravity of 1.035 and no tear production would indicate that the deficit is not resolving. The nurse should implement which interventions for a child older than 2 years with type 1 diabetes mellitus who has a blood glucose level of 60 milligram per deciliter. Select all that apply. هنا بمعنى تختار كل ما ينطبق عليه الإجابة، أو بمعنى إنك تختار أكثر من إجابة. The options are number A. Administer regular insulin. Number B. Encourage the child to ambulate. Number C. Give the child a tablespoon of honey. Number D. Provide electrolyte replacement therapy intravenously. Number E. Wait 30 minutes and confirm the blood glucose reading. Number F. Prepare to administer glucagon subcutaneously if unconsciousness occur. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct options are option number C and F. اللي اخترنا الخيار رقم C and F نشوف rational. Hypoglycemia occurs as a result of too much insulin, not enough food, or excessive activity. Glucose is administered orally immediately, followed by complex carbohydrate and protein. If the child becomes unconscious, glucose paste is squeezed onto the gum and the blood glucose level is retested in 15 minutes. If the reading remains low, additional glucose is administered. And if the child remains unconscious, administration of glucagon may be necessary, and the nurse should be prepared for this intervention. So the correct options are option number C and F. Encouraging the child to ambulate and administering regular insulin will result in lowered blood glucose level. And providing electrolyte replacement therapy intravenously is an intervention to treat diabetic ketoacidosis. And waiting for 30 minutes to confirm the blood glucose level delays necessary intervention. So the correct option is option number C and F. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.